Greetings from ECS Heart. I'm Dr. Dipti Itchhaporia. I'm the Vice President-elect for the American College of Cardiology. I'm also co-chair for the ACC International Conference in the Middle East. So we're going to be talking today about clinical advances in the management, in antiplatelet therapy in acute coronary syndrome. And I think this is a very important topic because there's been a lot of discussion about the length of antiplatelet therapy in patients that have had PCI and acute coronary syndrome. And so there have been many trials, including the most recent last week, the Twilight study that came out at TCT that looked at shortening the antiplatelet therapy. So after 3 months of dual antiplatelet therapy, the patients were randomized to ticagrelor and placebo versus ticagrelor with aspirin therapy, and those patients were followed for 12 months. And what they found was that there was actually no difference in terms of the ischemic outcomes at 12 months, but there was definitely decreased risk in the bleeding risk when it was ticagrelor alone. And I think in the past we've been worried about stopping dual antiplatelet therapy because we were worried about the ischemic risk. And so, but we also knew that dual antiplatelet therapy carried with it a much higher bleeding risk. So I think this was a very important trial that once again added to our body of literature that has shown recently that maybe shortening our dual antiplatelet therapy from the conventional 6 months to 1 year therapy, that we can maybe shorten it to 3-month therapy is something for us to think about. So I think there was several other trials prior to that, but I think that the one new advance in terms of antiplatelet therapy in patients certainly with acute coronary syndrome and PCI is this a growing body of literature that's saying that we should be starting to consider shorter dual antiplatelet therapy treatment. Thank you very much for listening. And we look forward to future conversations about this topic and certainly look forward to all the future data that comes out on this very important topic.